we're going to start right here then. What can we diagnose? Well, let's look at this. This is a 10-year-old boy who had a diagnosis of ADHD when he came to see me. And the vast majority of children who have a doctor's diagnosis of ADHD have these kinds of rings going around and around. Now, those of you who are on Instagram, I'm going to move my camera closer so you can see those rings really clearly. Whoops, there we go. So have these rings. Now, what is important with these rings? Now, these rings in and of themselves are not enough to say the person has ADHD. When we see these lines radiating outward, this intensifies what these rings mean. But that also is not enough to diagnose ADHD, because guess what, folks? We actually don't diagnose disease from the eyes. We don't use disease names. Unless you're a licensed medical practitioner and you're allowed to do that, the rest of us aren't, and we don't get to diagnose. So when we see these rings, what it teaches us is this is a person whose body burns through their B vitamins, vitamin C, calcium, and magnesium very quickly. When they are properly nourished for their needs, they like to have to-do lists and a direction in what they are doing. And they like to accomplish things. When they are not properly nourished for their needs, they have a hard time focusing. And it doesn't matter whether we're talking about a 6-year-old, a 10-year-old, a 25-year-old, or a 47-year-old. These people need their nerve nutrients. They need them balanced for their own particular needs. And when they've got that, they do much better. In addition, we may need, and there may be other indicators that we see in the eyes that tell us what format those B vitamins need to be in, what format the calcium and magnesium need to be in. And so we need to look for all of the markings that will teach us about how this body uses the nutrients. When we see these, there's other markings in this eye as well that suggest that this person, this little boy needed more protein than a normal, that's a really judgmental word, than an average 10-year-old boy needed. And so what we did with him is we got his parents educated as to the fact that refined carbs in all forms deplete B vitamins, that protein stabilizes blood sugar, that the B vitamins this child needed were in a particular form and he needed to be getting them twice a day. We talked about how often he needed to be getting protein and what forms of protein would be most effective for him. And when we did all of that, we saw his behaviors change radically. His mother broke her leg just shortly after I started working with this boy. And she said, you know, there she is laid up, not able to really do much for about 6 weeks. And she was getting pretty bored. So she invited her son to come and play Old Maid with her. And she said, normally we'd get halfway through a game and he would disappear. He'd be bored already. He'd be off doing something else. But they got through the first game. And he said, Mom, can we play again? And they got through the second game. And by now his mom is going, oh my goodness, we've got a major win here. And he said, can we play again? They got halfway through the third game. So his attention, his ability to focus was significantly improved because we were able to go in and work with his nutrients based on what his eyes had taught us. We needed to ask questions as we were doing the assessment here. So it was things like, what are his sleep patterns? How does he handle stress and frustration and anxiety? What is his favorite learning method? Is he audio, visual, or kinesthetic? These people tend to be kinesthetic. So the worst thing we can do with him is sit him behind a desk and make him be quiet. The best thing we can do is give him manipulatives, get him using his body, get him doing things physically. Like he's the one that you want to have carrying things back and forth from the art room or carrying things back and forth from the gym, because that's going to keep him from poking his neighbor, right? These are the kids that need physical activity when they are learning. That's how they learn. They use their bodies. So there are so many other imbalances that can contribute to ADD and ADHD, but the iris gives us suggestions. It gives us clues. It tells us which questions to ask. And when we understand what the markings mean, and when we understand what kinds of questions they are referring us to, we then also understand what kinds of recommendations to make. This is an eye from a client of mine who was in her mid-20s when she first came to see me. She had been diagnosed with polycystic ovarian syndrome. When we look at her eyes, and we're going to look at 3 cases of PCOS, and you're going to see that each set of these eyes is very different. So it's not that one particular marking tells us PCOS. So with this one in particular, her history was in the few months before she came to see me, she gained 40 pounds. Hello, Camellia, good to see you. She gained 40 pounds. Her menstrual cycles were getting further and further apart. Now, as we look at her eyes, what we see here, she falls into a category we call polyglandular. And that often will suggest to us that she is likely to have blood sugar imbalances and hormonal imbalances. I needed to ask her about her diet because typically women with PCOS have a diet that is very high in refined carbs, and they typically are flirting with or are full-blown type 2 diabetes. So I asked her about her diet. It was kind of garbage. And her diet was really totally white flour, white sugar, lots of junk food, was really, really awful. So we worked with her really solidly to get her diet corrected. She really wanted to have children. And so as we got her diet corrected, and it was tough because it was radical changes for her, what we found was that her menstrual frequency improved, and whoa, she got pregnant. She didn't need metformin. We just used a few herbs with her as well. Now, she went on actually to have 4 successful pregnancies, which she was thrilled about and still is thrilled about. She's got 4 beautiful children. So as we look at this eye, and we know that this one is someone who had a medical diagnosis of polycystic ovarian syndrome, I'm going to have you hold on to that image because this is also the eye of a woman who was diagnosed with polycystic ovarian syndrome. When she came to me for the first time, she and her husband had been trying for a couple of years to get pregnant. Her menstrual cycles were 75 days apart. Now, if you know anything about the menstrual cycle, anything longer than 35 days is considered to be subfertile. So at 75, she was definitely not having fertile cycles, even though her temperature chart suggested she was ovulating. A 75-day cycle is not a viable cycle. She didn't have a weight problem. Typically with PCOS, we see weight gain. We see weight that doesn't come off, and she was lean, she was petite. So when we look at her eyes, do you remember that we saw these rings in the picture of the little boy with ADD and ADHD? So we need to ask this woman, how do you handle stress? Does stress lead to cravings? And absolutely they did. The more stress she was under, the more she craved carbs. So we needed to give her the B vitamins in the right format as well to deal with that. Now, the B vitamins is not going to make those rings go away. Those rings are inherent. They're genetic. They're there. They're not disappearing. But we understand what those rings mean, that we need to provide the B vitamins in the right form. And so we also needed to do diet correction. Her diet was very high in refined carbs, and we needed to get her working out. So she works in a downtown office tower, and we got her walking the stairs every day at lunchtime for 20 minutes. And we got her going for walks every evening with her husband for 30 minutes. It only took us a few months to get her menstrual cycles down to 35 days. She did get pregnant in spite of the fact that the fertility clinic here in Calgary told her that she would not get pregnant without metformin and probably without all kinds of other interventions. She delivered a healthy 7-pound baby boy, full term. And her husband said the doctors were amazed. It was a 3-hour labor start to finish. Okay, so she had PCOS as well. And we were able to, because we understood the diet and we understood her need for the B vitamins, we were able to work with it. Yeah, Camellia, isn't that great? Yay is right. Yay is right. Here we have another case of polycystic ovarian syndrome. Now, this eye is a dark brown eye, just like the one we just looked at, but it has something very different in it. She's got a few contraction furrows and a few radial furrows. So we know that that is going to really dictate what we need to do with her B vitamins. But I want you to look for something very specific right here, right here. And in the blow up picture, can you see this? See how this fiber lifts right off the surface of the eye? It's as if you could take a little pin and slide it right under the bottom there. And so when we see that, that is called a gateway arch, a gateway arch. And when we see, okay, Andrea, I'll come back to your question in just a moment. When we see a gateway arch, it is a dead giveaway that this person likely is inherently prone to blood sugar disorders. So this young woman is 20 years old. She didn't want to get pregnant yet, but she knew she would, you know, in 4 or 5 years. She wanted to finish her university and then settle down. She came to see me because she was gaining weight. I asked her about her diet, and she said that it was high carb. She was eating on the university campus all the time. I asked her about her lifestyle, and there was no physical activity whatsoever, except for walking around on campus. I asked her about her menstrual cycle. I asked her, are they regular? She said, yes. And I said, so how many days apart are they? Do you have a cycle every month? And she said, well, yeah, they're about 4 weeks late every month. Okay, no, that's not, that may be regular, but what you're telling me is that you're running an 8-week cycle, which is what she was doing, which of course with the weight gain and an 8-week cycle, that points directly to polycystic ovarian syndrome. So we needed to do some dietary correction with her. We needed to deal with the carbohydrate cravings. We needed to get her some daily physical activity. Now, it's really important to remember that this marking here is not going to change. It's not going to flatten out. It's going to stay that way. She inherited this from her parents, maybe her grandparents, maybe her great-grandparents. She could have inherited it from 3 or 4 generations back, but it is still a problem that she has to deal with. So each of these sets of eyes is vastly different, but they all had PCOS for these last 3 sets. We have to understand the iris markings, what questions they lead us to ask. Then we have to understand the body well enough to know how to work with it. Now, Andrea, who was with me on the webinar, said, what do I mean B vitamins in the right format? Well, when you look at the label on your B vitamin bottles, you're going to find that the B vitamins come in a lot of different versions. Right? And so we need to understand first off, how is this person's digestion? Are they actually going to handle a tablet or do they need a liquid? Then we need to understand, does this person need the B vitamins to be methylated or not? Will they do better with, we need to get picky about it. This is where we need to understand not just iridology, but we need to understand physiology, and we need to have an understanding of other things like nutrition and or supplements and or herbs. Right? This is why I tell people who come to me and they say, I want to learn iridology, I want to be an iridologist, and I'll ask them 2 questions. Number 1, do you have a background in anatomy and physiology? And number 2, what other training in holistic health do you have? And 9 times out of 10, they say none. I just want to be an iridologist. And it's like, well, that's like being having a car mechanic garage, and you know how to assess a problem, but you don't know how to fix it. You need a modality. You need to understand how the body works, and you need to understand different things that you can do to actually help fix it, right? To help bring the body into balance. All right, here is another case of PCOS. All right, so get a good look at these eyes. See how different they are from everything we've already looked at, right? So this is important. This is super important. This client had been trying for about a year to get pregnant as well. And she had no luck. She is one that has some of the markers that tell me that she needs her B vitamins in a different format. Besides the fact that she is polyglandular, right? And you can't see them well because these images are frontally lit. Side lit images would be better. You can see she's got hints of the rings in her eyes. And she's got a very particular marker that's really hard to see unless you're actually looking at big, big pictures of her eyes that says she needs her B vitamins in the methylated form. So we started her on the methylated Bs right out of the starting block when she first came to see me. And we did a few other things too. High stress woman, she internalizes her stress dramatically. The number of times I had to literally talk her down off the shelf or off the ledge, if you will, was amazing. Not that she was suicidal, but she would just be vibrating with anxiety over anything and everything. And so we really had to pad up her Bs, had to teach her some stress coping techniques. And she finally did get pregnant, which was great, about 6 months after we started working together. And then about halfway through the pregnancy, she did 23andMe. And then she sent me another email. And that email literally vibrated. I thought my computer screen was going to blow up. It had so much energy in it from her email. And she was freaking out. 23andMe said she had the MTHFR defect. And she was going, oh my goodness, what does this mean? Am I going to die? What about my baby? Is my baby healthy? What can we do about this? And I was able to say to her, you know what? I suspected from what I saw in your eyes that you did have the MTHFR defect. And because of that, I put you on the right kinds of B vitamins from the get-go. That's why you got pregnant. I suspect if you had not done the B vitamins that I had suggested for you, that you would never have conceived. And then I said, now I need you to take a deep breath. I want you to go, and even though you're still pregnant, I want you to dance with your baby. I want you to sing to your baby, and I want you to read stories to your baby. Your baby doesn't need this anxiety. Your baby needs you to just love and sing and have fun with him. So just take a deep breath, right? Now, again, we cannot tell from looking at the eyes who has PCOS and who doesn't. But I know the symptoms of PCOS. And when I have a client who comes in with those symptoms, I know how to look at the eyes to ask the questions to help me understand what is important, because not all PCOS needs methylated Bs, right? And so we need to be able to ascertain that by looking at the eyes. Let's look at one more eye. Now this is sphincter of Oddi. This is a client who came to me. Well, this isn't. This is an anatomy diagram. But a client came to me. We'd worked together for about 10 years, and he'll fade away for a few years. Then he'll come back for 6 or 8 months, and then he'll fade off for a few years. And I'm perfectly good with that. That's what I like. I like to be able to teach my clients what they need to know to deal with their own health, to protect their own health for a few years. And then as they're getting older and their body shifts, they come back for more private coaching, is how I like to refer to this. So he came in with a problem that he suspected was sphincter of Oddi. Now, I had no idea what sphincter of Oddi was, because that's a really, really tiny part of the body. So as we look at this image, we've got the liver. Camellia, thank you so much for that compliment. She's saying great content. We've got the liver, and the liver, as you know, makes bile that is stored in the gallbladder. When you need bile to emulsify fats that are in the small intestine, the gallbladder goes squirt and squirts the bile out, and it comes down here through this common bile duct down here, and it squirts the bile into the small intestine to emulsify the fats. Now, he had run into some problem with gallstones in the years between when I saw him last and when he came back, and he had his gallbladder removed. And that's okay. It's absolutely okay. We work with clients where they're at, and it's not up to me to tell him yay or nay on a surgery, right? And doing a gallbladder flush to get rid of gallstones is a dangerous procedure. And so he was in so much trouble with his gallbladder that he deemed that it was best to just take it out. So that's great. One of the complications that often comes up after the gallbladder comes out is this sphincter of Oddi that's right down here, either develops scar tissue and begins to close off, or it goes into spasm and it spasms shut. All right, so he came in saying, I've had my gallbladder out. My doctor doesn't know what's going on. I've done research. Here's what I found. And he said sphincter of Oddi. So I did spend a little bit of time researching because lots of people get their gallbladder out and I might see this again. And so it sounded like, yeah, you probably have sphincter of Oddi. Now the medical world has nothing to offer these people. Nothing. There is nothing they can do to correct sphincter of Oddi, and the ongoing pain is, well, it's ongoing, and the nausea and everything that comes from it. He'd almost been better off keeping his gallbladder, but he can't, and so there we go. So as we look at this, this is his right iris, and we know that because the pupil is always off center, and the narrower side of the iris names the eye. So the narrow side here is the right side, so this is a right iris. When we look at this, the gallbladder reaction field would be sitting right about in here. And what you're going to see here is there is nothing there. Nothing there. There is no marking that says gallbladder. Now, why is that? Because gallstones are not genetic. Gallstones don't change your genetic structure. Building gallstones doesn't happen because you've got a faulty genetic structure. Gallstones, if we look at German New Medicine, are about retained anger that has not been resolved. Now, if you knew this gentleman, you would know he's tall. He's like 6'4". He's huge. He's strong. And he's the gentlest person you would ever care to meet. And the gentleness is how he truly is, but he does that at a price. He stuffs his anger. Rather than getting angry and letting it out, he stuffs it and hides it. That will lead to gallstones. Now, the surgery to remove it also did not change his genetic structure. So there's no marking in here that suggests that he had surgery. Okay, so we don't have a specific point in the eye for the sphincter of Oddi. We do have gallbladder, but none of what he's gone through there is inherent or is genetic. And so it means that we are not going to see anything in the eye about that. All right, so as we look at this, knowing what we know about him and knowing that he retains anger, the best thing that I could do was teach him more about anger management, more about how he needs, it's okay. Angry, nice people get angry. Nice people get angry. It's how they get angry and what they do with it that helps them retain their label of being a nice person. And so we talked about how he probably would need to be working with this anger in different ways, because now that he's taken out the gallbladder and now that it's affecting the sphincter of Oddi, that anger that's been buried is going to show up in other places in other ways. And Camellia says processing emotions are vital. Absolutely. I couldn't agree with you more. Could not agree with you more. Isn't orange a pancreatic coloring too? Yes, orange is a pancreatic coloring, but it's pancreas, not gallbladder, right? And so while the common bile duct does connect sort of the gallbladder and the pancreas, this would have not much to do with sphincter of Oddi. And his diet was clean. He doesn't do junk food. He's really conscientious about his proteins and his veggies and not drinking coffee and things like that. So he's pretty good that way. This is all about the anger. Now, when we talk about emotions and pancreas is playfulness. It's joy. So what have they done? They've joined a pickleball league, he and his wife, and they've been playing pickleball for a few years. And so it's, he's looking for the ways to have more fun in life, which is absolutely brilliant. So where does that leave us? Where does that really leave us? Well, it doesn't matter if you're a herbalist, a nutrition coach, an aromatherapist, or a naturopath. It leaves us at the point that one marking does not equal one symptom, and we really cannot diagnose from an iris. We can assess, which is entirely different. Now, I know there's another question came in. Oh, it's Andrea saying, thank you for clarifying. You are welcome, Andrea, my pleasure. And so this is really important because iridology gives us insight into what our clients are capable of physically, right? It teaches us the questions to ask. So a client comes in and says, yeah, I've got a problem. I never play the crystal ball game with them. It's not like, well, I'm going to look in your eyes and tell you what's wrong with you, because I used to do that back when I used a different style of iridology and it didn't work. However, when I say, tell me what you'd like my help with, and they say, well, I've got this problem, and they describe it to me, then I look at their eyes and it helps me understand why they've got the problem. And that is far more valuable than me playing crystal ball to try to guess what's wrong with them. So my very wise iridology instructor, Bill Caradonna, taught me that the eyes teach us what questions to ask. They give us understanding. And that is exactly what we want, how we want to use this. Iridology is an assessment tool. It's not a diagnostic tool at all. It points the way to the questions that we should ask. It guides us in dietary recommendations while suggesting what the genetic potential for an organ or an organ system or the body is, but it is not diagnostic. So going back to some things I said earlier, if you've been hanging with me for any length of time, you know that I love mentoring practitioners who want to use constitutional iridology in their practice. I like to teach them what I know. I want to help them create a more successful business. And I want to get the truth about what iridology really is out there. I want to get rid of all of the myths and the fables and the misinformation and the diagnosing that's going on. So for the past several years, again, I'm just going to touch on this for those who might have come late. We've got this, I've been teaching this program, Dynamic Iridology Assessment System. And Janelle, I'm going to pop back to your question in just a moment. I'll do that at the very end, so hang tough with me. I appreciate you getting up at 3 a.m. to join us this morning. This is a program, Dynamic Iridology Assessment System. It's taught via live webinars, and it is for holistic practitioners who love doing one-on-one work, but they're tired of spending their own time creating programs. So many of them see the client, gather the history, then they go off and they spend 2 or 4 or 6 hours creating a program to bring back to the client, and they don't get paid for the time they're spending creating the program. It burns them out. It makes them begin to resent their business, and they begin to think, isn't there a better way? There really is a better way. By using Dynamic Iridology Assessment System, you can stop working that unpaid overtime. You can develop your client programs in your client sessions, and that's exciting because when you get it done in your client session, you're giving them a program they can actually do and be successful with. That increases client compliance. I've got clients who've been with me for 38 years. I've been in the holistic health business for 40 years. And so, you know, to have people that have been with me for 38 years is quite an accomplishment. I've now got 3rd generation clients where I saw the mom 38 years ago when she was having babies, and now those babies are having babies. So that's kind of exciting. This doing dynamic iridology this way will create better success for your clients, which means better success for you, and it will lead to long-term retention, which is super, super exciting, super exciting. So there is an information session today at 5 p.m. Mountain Daylight Time. So that's happening in about 5.5 hours. And once more, for those of you who were with me live on the webinar, I'm going to repost that link so that if you want to join me to learn more about this, you certainly may. If you're with me on Facebook or if you're with me on Instagram, please DM your email address to me and I'll make sure you get the link. Now, one more question Janelle was asking. So to clarify, the 10-year-old's body burns through B vitamins, vitamin C, calcium, and magnesium. Yeah, we needed to get rid of the refined carbs for him. So she asks, is there other requirements, other nutritional requirements? Yeah, get rid of the refined carbs and increase his protein by giving him more doses of protein in the day, right? To stabilize his blood sugars. And when we did that, it was like, oh my goodness, this is magic. This is absolute magic. This boy is getting great results, and we're so excited about that. Excellent. So any questions for me? Anything else that you need me to cover? Janelle says, fantastic. Thank you. Awesome. Happy to help. All righty. And Camelia on Instagram is saying, great experience. Thank you. Appreciate that. I look forward to hopefully seeing you in 5.5 hours on the info session. Again, if you need that link, DM me, or if you're on the webinar, you can copy it from the chat window. And yeah, I look forward to seeing you this evening. Have a fabulous day. Take good care. Bye for now.